now. And 5, 4, 3, 2, 1.
Hi everyone, I just need to check that I'm definitely live. The reason being normally my box is red when I'm talking and today it isn't. So I just need to make sure that it is properly working. So can somebody on the live Q&A just come forward and say, yep, we can hear you. Just want to make sure that it is actually working. There's 65 of you currently, which is brilliant. But I'm just making sure. Now we haven't got anybody putting anything forward right now, which would suggest I am not live. Okay, can somebody please just, wonderful, there's 69 of you now, wicked. I just want to make sure that you can hear me. Can somebody just say, hi, yes, we're here. That'd be brilliant. Yes, wonderful. Thank you, thank you, thank you. Brilliant, brilliant. Okay, so fabulous. We've now got 71 of you. So that's awesome. So Stuart should in a minute just be sharing the screen with you about our kind of presentation that we're doing today to talk with you about it. Now, we're still trying, ironically, to be the best that we can be in this situation with COVID. So bear with us, but we do hope that the appointments that we're going to talk to you about are going to show about all the efforts that we can constantly make to try and make it as easy and straightforward for you to use and access our services. So as we move in, let's go to the next slide to be able to do that. Okay, so this month's meeting is all about navigating our way through COVID. I know we don't like talking about it, but today is quite an epic day, isn't it, of freedom, and yet we're still wearing our masks that I'll talk to you about in a bit. Our appointment system in general, and then Dr. Green is with us. Dr. Green, can you give us a wave? Okay, I think you caught that with him then, to be able to do that, and he's going to talk you through what actually is involved in a telephone consultation, and then also what services you can self-refer to, which might be quite interesting for you to be able to do that you don't need to contact us for, some that you may not realise that you can actually contact directly. So let's move into the next slide. Fab. Oh, this is how a live Q&A works. Now, I had thought about not putting this in, and then I thought just in case we've got some new people with us tonight, I'll just go through again. So remember, get your live Q&A feeds up on your screen, ask questions, keep an eye on them. If somebody asks a question that you like, click it so that we can see. I'll do everything we possibly can to answer every question. And remember, we will address them at a later point in time, even if we don't get to it tonight. Promise you that. Your feedback is invaluable to us and we really, really appreciate it. So we don't come to these things thinking what if, how, when. We come to listen, and we do want you to share what it is. So apparently nobody could see you, Dr. Green. So Stuart, can you make sure that we can move the screen over to Dr. Green so everybody can see him? Fab, so you are back to me. So hopefully you got a little wave from Dr. Green there. He was on mute, just because he's not talking right now, but he'll be back with us in a little bit. So as you can see, just get yourselves into kind of the swing of the live event. Right, next screen then, please, Stuart. Okay, appointment system. So as you know, that's what we're going to talk about. So let's move on to the next screen. Fab. So what can you expect now when you arrive? Now that's really important, and I'm starting off with this one rather than actually booking an appointment and the range of services we've got available to you. We're starting off with what to expect, because of course today face coverings are no longer mandatory. However, we have risk assessed, and we still need you to wear a mask when you come in for a face covering. Okay, all of our staff are still wearing the screens and the PPE accordingly. Our numbers, our prevalence of COVID is still going up every single day. We've had 2 more people have to isolate today just with us because they've had a ping on their NHS track and trace. The more and more episodes of this does compromise what we can offer. So therefore, we're taking every precaution that we can take whilst still balancing with opening our doors to you and keeping us alive and with you so that we can deliver that service. So please, when you come in, we are still social distancing, we are still wearing face masks, we've still got anti-bac, we're still doing all of those things that we were doing before. But some of you may not have seen some of our new technology, which is in particular called a temp cam. So as you arrive into the practice, either Durrington surgery or Uphaven surgery, you're going to walk through the doors, go to reception. You must go to reception. So at Uphaven, that's at the counter as you turn left into the front doors. To be able to do that in Durrington, it's now straight in front of you, in front of the doors. It's no longer in the waiting area. It's at the front doors, okay? So that's in Durrington. At both receptions, you've now got temp.cams. These are electronic thermometers that you stand in front of and they read your temperature. That sends a message to reception to say whether or not your temperature is below 37.7. If it is, no problem at all, you can come on in, okay? But if it isn't, then you need to be able to wait outside. But before you go, we will ask you some COVID screening questions. We have to ask these questions. I know that they're frustrating. Reception is have to ask every single person 7 questions time and time again. But the first one, and I know that it sounds random, you'll be like, why on earth do we need to do that? But we've changed our questions to add in 2 more. The first one being, do you think you've got COVID? Because we have had incidences whereby patients have answered no to all the questions like, do you have a new continuous cough? Do you have a high temperature? Have you lost your sense of smell or taste? Have you been abroad? Are you living with anybody who is isolating due to COVID? People have answered no. They've got into the consulting room and said, oh, but I've got COVID, but I've come in about my wound, or I've come in about X, or I've come in about Y. Because there's no problem, I'm not unwell with COVID. Well, of course, I know that that sounds tremendous, but actually, if you've got COVID, even if you haven't got symptoms and you're not unwell, you still need to isolate. You still need to stay at home and you shouldn't be coming into the surgery. So that's why we've changed our questions now. First question being, do you think you've got COVID? If you do, or you know that you have, then of course you will need to go back to your cars. Okay, and indeed our last question, are you awaiting a PCR result? So your big test that you have to drive off to, not the lateral flows, but the proper test. If you're waiting for a result, doesn't matter whether or not you've got symptoms. If you're waiting for a test result, you must isolate until that result comes back. And if it's negative, then of course you can come back and see us face to face. So they're the questions that are asked at the beginning. You can then go and sit in the waiting room. Now, in Durrington, that's capped at 8 people sat in the waiting room, and in Uphaven, it's capped at 6. That's due to the size and what we're allowed to have people waiting in the areas, okay? Because we've done that, we offer anti-bac wipes for you to use the chairs if you want to. If you don't have to, it's your choice, but the wipes are there for you to use if you so wish, so you can wipe down the chair that you're going to sit on. Look to do that. And accordingly, then you can sit and wait for your appointment. If indeed you've answered negative to all the questions and your temperature is okay. If indeed, though, your temperature is high or you've answered yes to any of our screening questions, you'll be asked to leave the premises, wait in your car or wait outside, okay, if you are well enough to do so. If not, you will be moved into a consulting room that will then turn the isolation room, and somebody will try and consult with you as appropriate from there. Now, of course, what we've got at Durrington, which is what some of you will know, is that we've now got a new consulting room. We've moved our meeting room into a consulting room, and you'll be able to access it straight from the car park. Brilliant result. You don't have to wait in the waiting room. So if you do have some symptoms that are associated with COVID, but actually the clinicians want to see you and don't think you've got COVID or feel that actually you must be seen, our clinicians are able to do that as safely as possible. It does put them at risk. There is no doubt about it. Indeed, it can put you at risk. according to who other people might be in the room before you or after you, as much as we can clean in between people. But at least we do have that facility now, and we have another room, which is brilliant. Now that room is literally, like I say, you don't come into the waiting room to access that room. You'll walk straight in off the car park. It's next to PharmaSelf, and I hope that a lot of you are benefiting from PharmaSelf. 24/7 collection. What more can you ask for? Brilliant, brilliant. Wipe down, not have to come in, not have to wait, no queues. Awesomeness all the way around. So that's what we've got in terms of what to expect when you arrive. Okay, now we're going to start talking about booking an appointment. Now, that's an important part. And before we go through what to book, what I'd like to do is transfer you over to Dr. Green. He's actually going to talk to you about what happens in a telephone call, because we think that it's quite obvious for you all what happens when you arrive face to face, because you often see what the doctors and nurses and clinicians are doing in front of you, whether that's typing on the computer, having to make a call, look up a number, etc. But of course, on the telephone, it's a little bit of a more remote surface of what happens. So Dr. Green's going to just talk you through what happens from the other side, inside the GP surgery when they're doing telephone calls. So over to you, Dr. Green, to give us a kind of run through of what happens.
Hi, I hope you can hear me. Yeah. So a lot of people get booked into telephone calls. We have many phone calls a day, 50, 60 some days, and a lot of people are on the phone for 5 minutes speaking to us. But actually, prior to picking up the phone and actually ringing someone, we're pulling up your notes, we're having a look to see who you last saw, what that was about, seeing if you've had any recent blood tests done, seeing if there's any recent messages on the system for you, and just getting a feel for who that person is, more so if we don't know them very well. If it's a patient you've dealt with regularly, and a lot of times you may not need to do too much in the way of looking around before you phone them. And then we phone people, and it's lovely when they answer first time, but not everybody does. But if you do answer first time, we've probably spent 2 or 3 minutes looking through the notes before we start speaking to you. I, for one, cannot type as fast as I can talk, and I certainly can't type as fast as patients can give me information. So I am typing slowly in the background, all the information and working out where we go. And there are often pauses where I do need to look for other information that I probably haven't prepped prior to that particular consultation. At the end of that, we come to sort of a plan what we're going to do with that one condition. But quite often patients, whilst they're on the phone and I'm still typing up and it goes a bit quiet and I'm trying to arrange maybe an X-ray or organise some blood tests, we get the call, do you mind if I just ask you about something else? And immediately people start talking about something else whilst I'm still trying to record what we've talked about first of all. And that can be a little bit tricky if it's for 2 issues, but if people go on talking about 2, 3 or 4, it becomes really quite difficult. And it's not that we're trying to be difficult when we say just hang on there, I can't record it all, or just stop a minute, because it's very difficult to do 2, 3, 4 things at once. And at the end of the 5-minute phone call that you might think that's all we've done, and we put the phone down, we then have the rest of that consultation to type up, and we have the actions to then process at the same time. So that can take us another 4 or 5 minutes, and one 5-minute phone call from the patient side of things is quite often 10 or more minutes from the doctor or nurse practitioner side of things. So do bear with us when we're on the phone and we maybe get distracted or ask you to repeat stuff. It's normally because we're busy doing something else rather than not listening. I think that's all.
Stuart, have you put the programme back to me?
Yes.
Okay, cool. Sorry about that. I didn't know quite what was happening. Right. Okay, so Dr. Green has spoken to you about the background of the telephone calls, and we thought that it was really important to do that, to work through the fact of not answering telephone calls. And we know, and we totally get it, that you book a phone appointment and we don't tell you when we're going to phone you back. Okay, I understand that. You might have gone to the toilet, you've got another phone line going, you're on MS Teams because you're working from home, all right? You've had to pop through the shops. We get it. But the issue that we've got is, like Dr. Green said, you've got to do that records review every time, and it's slowing us down. So what we're really trying to do is that if you can tell us kind of, if you can't answer the phone, let's say you phone at 8 o'clock in the morning, okay, you need a call back, but you know you've got a meeting 11 till 12. Let's go on that, okay? Can you tell the reception team that you won't be available between a certain time? It really helps, because it means that if they can't get access to you, they know that, and they don't try between 11 and 12. And it's moving that forward so that we can work together. That would be awesome, to be able to do that. And it's just, if you can answer the phone first time, it's really good. And remember, it's a private number, okay, which again, lots of people have got blocked. But we do that because there are people that we need to contact, and we're not always aware of that when it comes to safeguarding, issues of concern, issues of abuse. And actually, they don't want anybody to know that the doctor's surgery has been involved in any way. So we're caught, and sometimes we don't know who those people are, almost until it's too late. So over time, that's why we have our number being private. So that, I hope that's useful. Do ask any questions about the telephone system, because if we go on to the next slide about that, hang on a minute, Stuart's just been getting up, so I don't know what he's doing. Can we go on to the next slide? Okay, this is the list of things that we've worked through, and I'm going to leave that on the screen while you're having a read of it, but I still want you to give me to listen, because what we've been able to do with our flow, and that's from the temperature checking from the beginning all the way through, so you're not sat in the waiting room waiting for somebody to undertake any COVID screening. You're sat with us. We've been able to increase our capacity. We also absolutely value your level of intelligence into your own healthcare and well-being. We have worked tremendously well together. Well, I joined in 2010. And I can say tremendously well since about 2011, when we started a huge campaign about SMS text messaging, how we were going to use the telephone system. Because remember, for those of you that were still with us then, that is Uphaven shut due to a flood for 4 months. So we had a huge amount of work and activity to do. If you have any of these issues, we feel that the most efficient way of caring for you from the outset is for you to have a same day telephone appointment. Okay, so it's to call us to make an appointment. Now, admittedly, the one that you've got to be clear here is a UTI. If you think that you've got a urinary tract infection, we need a sample. So when you call us and say you think that you've got a urinary tract infection, okay, be prepared for the receptionist to say to you, please, can you drop in a sample? They will still add you to the telephone list to talk with you, but the clinicians can't do anything until they get the sample. So if you then say, or when we can't get the sample and don't drop it off, we're trying to phone you, we really need those samples in. So please listen to the receptionist when they say, please do this, please do that. Also importantly, you'll see a few stars dotted around on our screens, okay? Is about a certain thing that we need you to do, having made the call. Now, just for interest, I'm going to pass you over to Dr. Green, who's going to tell us what the star means, Dr. Green.
I'm assuming it means have a photo on your phone ready to share with us, which would be really useful. If they're in focus, all the better. Sometimes we can make a diagnosis from a photo, or be guided a lot more whether we actually need to see you face to face or whether we need to see you that day or a following day. Photos that are already taken, stored on your phone, we can actually get you to send them to us during a phone call and have a look, rather than phone you, then do the imaging and then phoning you back, which is 2 phone calls instead of 1. So if you're asked to try and make a photo, that'd be really useful. Thank you.
Okay, is it back to me? I think it is, isn't it? So what we've got here in terms of those things then is that we are trying to increase this list. So these are the things that you need to have a phone call for. But on the next sheet is, and let's hope Stuart will pass that on. Okay, are things that we do need to see you for. So whereas kind of previous, okay, back in June, June, May, in the last 12 months, where NHS England said that we must give you a phone call for everything. We cannot see you without having or doing clinical triage beforehand. Now we are able to book some appointments that we know we need to see you for. So when you phone up and say you've got abdominal pelvic pain, the receptionist will be trying to book you an appointment to be seen that day with a clinician, with a doctor, okay? With ear pain, earache, ear infection, leg pain with swelling for less than 2 days, okay? These are things that we will need to see you for. So you know that, and I think this is the same information that we used to provide and work with you pre-COVID, if we can remember those days, about what we're doing and how we're doing it. So you will not need clinical triage, as in a telephone call first with a doctor or nurse to then say come down. We know that we need to see you. We know how to screen you when you arrive for the COVID elements for that, and we will see you and care for you face to face. That also comes into the routine telephone calls, the routine face to face. So things that can wait, okay, that don't need to be seen today. Don't need to care for today, can wait, which we know that you're quite often able to decide that. You know what you need, you know when you need to be seen, okay. We now have that service available too, which we weren't able to have before, in line with NHS details on that front. Now I've just been sidetracked slightly because the questions popped up saying, will you make the phone face-to-face slides available after the session, perhaps via the website? Yeah, so we will put our video back on our YouTube channel, as we always do, to be able to do that. We will be changing what we, as in recording this, in terms of into a newsletter, into a briefing for easy reference for everybody to be able to do that. But still remember, you do need to tell the receptionist what it is that you need, because they need to record that in the appointment that they book for you, so that the clinicians can triage and prioritise and make sure that they get to everybody, and the most appropriate clinician, aka is it a nurse practitioner like Emma, is it Dr. Green, is it a different doctor, etc., can work through that. Okay, so that's why the receptionists record and ask you the reasons for their appointments, to ensure that you're willing and able to see the right person as timely as possible. Now, I'm really sorry to read, somebody said, seems to me that if you're doing something else, you're definitely not listening. I'm really sorry. That sounds like a very upset message. I'm really sorry to hear that. If you can give me some more details about what you're unhappy about, then maybe I can help explain that, or we can address that and look at it and try to resolve it.
Do you want me to answer that just quickly?
So yeah, Dr. Green would just like to say something here as well. So Dr. Green, over to you.
Sorry, I think that okay, so the question about if you're definitely doing something else, it sounds like you're not listening, I think relates to the idea that when we were talking about phone calls and trying to record it and patients carry on talking about the next thing, we're typing and they're talking about the next thing. And I think, you know, a lot of us can listen and have a conversation whilst doing many other things, driving, cooking, all sorts of things. And on the computer, there are certain things that you can almost do automatically. So we do listen. But I think that the point is, if we are doing something else and we go back and say, oh, you were talking about some back pain you had, then can you just remind me how long you've had it for? Because they might say at the beginning, oh, I've had back pain for the last 3 or 4 days, go on to tell me a lot more information. And then I go back and ask them to just reiterate what was said at the beginning, is because although I'm listening to what they're saying, getting the precise details sometimes is you can't remember. And that's really what I meant. Over.
Thanks, Dr. Green. Okay, so hopefully that's helped resolve that point, so that in terms of understanding about the telephone calls, that makes sense now that Dr. Green can say that, and he's looked at those things. Okay, so what you can see, what we're trying to do is re-establish the pathways, the ways in which our appointment system worked before COVID. There's some things we can't change, okay, but as you can see, we've got a transition whereby you're able to book routine appointments with a doctor without having to have clinical triage with somebody phone you first, by not nurse or doctor, to find out what you want your appointment about. And we do that. Now, remember, as we put this system in place, like with anything, it takes time for it to fully embed. We started it on the 5th of July and we've been moving forward. I don't expect this to come into fruition in its totality in terms of we're really feeling the difference until the end of August, beginning of September. Okay, now that is if, and I'm really honest about that, as long as we don't go down with COVID, with having to isolate, because the rates of COVID-19 in Wiltshire are going up by the day. So bear with us in terms of moving forward. So that's what we've just got to kind of look at, work through, and make sure that we are heading in the right direction. But I really hope that those things have come up and been really useful to be able to use our appointment system wisely. Like I said, remember, it's a private number. We get totally about doing other things when you're waiting for a call back. I know it's frustrating, but it's a bit like where Dr. Green was saying about needing a photo for certain things. Okay, really hard to take that photo of a mould when you're stood in the Sainsbury's queue, for argument's sake. Okay, so bear with us. If you need to do something, if you could just share what you're doing when, so that we call at an appropriate time in that morning when you know that you're going to be out or you won't be able to answer the phone, then we can do that. To look forward for routine calls, you know, and routine calls as well to move that. So hopefully that will work. Now, can I just ask, are there any questions about the appointment system while I just talk to Dr. Green and say, Dr. Green, is there anything else you want to say about the appointment system while people are just thinking about the next question?
Yeah.
Yes, he does.
So much as it's useful to know when not to call you because you're in a Teams meeting or something through work between 11 and 12 o'clock or whatever, it is impractical stroke impossible if people ring up at 8 or 9 o'clock in the morning and say, can I have a phone call after 5:30 tonight because I'm at work all day? Because we have a limited amount of time, and I don't think we can put urgent on the day phone calls, all bunching them up at the end when we have no time to deal with anything else that comes in at the last minute. So that would be, yeah, useful to know when not to phone you, but to try and avoid telling us to phone after 5 or after 5:30 so that you've finished the day at work.
Fab. So thanks, Dr. Green. While we've been on the line, you've been talking, Dr. Green, we've had somebody just ask a question about how to send a photo in advance. I've just replied saying that actually if you take the photo and keep it on your phone whilst you are speaking to the patient, when they're speaking to you, okay, the clinician can send you a link to follow whilst you're on the phone to press and send the photo, and they receive it immediately. To be able to do that. So we will send you a request. If we do want it in advance, we can send you that same text message in advance to click on to upload the photo, and it will get sent directly to us and uploaded accordingly. We only upload and keep photos in accordance with our insurance company mandate, and that is, would we keep that photo for longevity for the care of that person routinely? So things like a sore throat. If we were asking you to take a photo, we wouldn't upload that into your medical record and keep it there. The doctor, nurse would use it to evaluate your throat, write their description in the consultation, and then remove it. That just prevents your medical record being completely and utterly filled up over the years that this is going to happen for, and keep it of a reasonable size, and only keeping photos of, say, particular symptoms, issues that the clinicians feel is appropriate. So that's what we're looking at. Now, somebody else has said, do you see this system as a permanent operation for the future? So in terms of having people phone up for items that they need for the same day, through to coming in for same day problems, and being able to book routine appointments without clinical triage? Yes, we very much hope so. It's what we used to do pre-COVID. The thing that we also used to offer was, of course, a walk-in clinic. Now, at the moment, we're not able to offer that at the moment due to capacity, due to the guidance of how long you're waiting for and keeping everybody safe and the prevalence data that's coming in. But if we can, we will introduce that walk-in service again, because what we feel is really good about Avon Valley for all of you is that you have a variety of ways of being able to use the services that we offer. We don't just have one method whereby everybody has to follow the same way. If you wanted to walk in, you could walk in. If you needed a phone call, you could have a phone call. You could book in advance. You have every option that you could have to be able to book online, through to sending us messages through our website, being able to phone us. And that's what we are going back to. And I know it's perhaps not as quick as what everybody wants, but we have to do it safely and we have to do it well to keep our services going for all of you, for the longevity, for the sustainability, to be able to do that. So that's what we are trying to do. Just for a moment, Dr. Green, can you read the third, I think it's the third message down, please, and then let me know if you want to answer it. Well, not if you want to answer it, but as in can answer it live, or whether you want to reply to be able to do that. So now somebody else has messaged, and I think this is really important about the telephone system. So what happens if you can't get through to the receptionist on the phone? I've hung up for an hour on several different times during the day and failed. Okay, two things there. One, in terms of you can use our system online. So if you've got the internet, use our website to be able to contact us, to be able to do that, because some things we can do directly through that. We don't want you sat there waiting. The other thing is we may have a bug on our system whereby if you are waiting for that period of time, it means that somehow your phone, and I'm so sorry to say this, your phone call has got lost somehow in the system and it isn't ringing in the building. Now we need your details that confirm what time you phoned, number you did. So if you can take a screenshot of that call and send it to me, or give me the details of when you called to be able to do that, we can log it with our company. So we've been looking for people because we're aware of one or two, but it's not enough to find this bug. Our comms, our telephone system supplier is looking into it, but it's looking for that, a needle in a haystack. So please, whoever you are that sent that message in, please do, and I'll reply to you directly to say, please do tell us who you are, what time you phoned, what number, etc. Takes, whatever, and we will look through the system, and you might be the one that's able to help us find that bug and sort it out, to be able to do that. Don't wait more than if you're waiting more than 10 minutes to get answered, please don't ring off, try and do that. I'd even say 5 minutes, because we have so many people on the phones answering as quickly as we can. Okay, we have, like this morning we got 1, 2, 3, 4, 5, 7, 8, we had 10 people answering the phones. We're going as quick as we can, I promise. So please, if you get stuck, I'm so sorry, but do tell us, do report in and say there's a problem, because we're looking for that to be able to do it. So Dr. Green, do you want to answer the question about the medication?
Well, I can try. So there's a question about a medication review that looks as if someone managed to get a phone call with the on-the-day phone person, only then to be booked in for an appointment 3 weeks later, I think is the gist of it. It's difficult to answer that because it's not really specific enough. Medication reviews vary considerably on what is required and how many medications, what medications people are on, whether they need blood tests before the review is done, so whether they were done or not. All I would say is if people are heading towards a medication review and they can't get it done before the timing, we can always issue another month's worth of medication. We can even bounce it on by a couple of months to get things done that we need to get done, and then do it properly, whether that be a phone call or whether it just be reviewing blood tests. Why does it take 3 weeks? I'm afraid at the moment we haven't got enough capacity to offer all the on-the-day phone calls and routine phone calls constantly at that short notice. So you know, I'd love to be able to speak to people when they ring up and want to make a routine phone call or a routine appointment and see them all within a week or two. But at the moment, that is not happening, sadly. Hope that's answered it.
Fab. So please, whoever that was, you're anonymous. If you can let us know in the private chat, we can kind of follow up directly with you. Andy's now said the online appointment has led to sort of walking today. Is that changing back to the surgery? Yes, you should be able to book appointments online now to be able to do that. I will check with our administration manager to make sure that all the sessions that she's put on are bookable online. We do also, remember, we book only 2 weeks in advance. That's what we've always done previous. I didn't actually mention that. I can't even remember sometimes some of the things we used to do and just assume that everybody remembers. But yeah, we still do the 2 weeks set of appointments purely so that people don't forget. It reduces our DNAs, it enables us to act quickly if we need to change your appointments to be able to do that. So yes, that will be well, that should be in effect now, but I will go and check it to go and see what's happening. But of course, remember, they turn to being available to book at 8 o'clock in the morning, the same time that our telephone system goes live, so that there is no difference between telephone and people that use the web. And they only go up to what is ever is available 2 weeks time, and but it updates every single day and releases appointments accordingly. So you will be able to book that. OK, so next screen, Stuart. OK, so we've talked quite a lot about appointments, and of course one of the questions that came up earlier on the feed was about PharmaSelf. Now, before we go any further and talk about PharmaSelf, I'm just aware of the time of 6:10. Dr. Green does need to go back and finish his clinics for this evening. So if I can say thank you, Dr. Green, for spending some time with us, and yeah, we'll see him maybe next time.
Thank you.
Fab. So he's back. OK, so PharmaSelf. Now this is what PharmaSelf looked like in the manufacturer's shop. It isn't what looks like at Durrington Surgery. So PharmaSelf is a dispensing robot. It's a dispensing robot whereby you can collect your medicine without having to come into the surgery. OK, this is awesome. You do not have to queue. So all you have to do is order your repeat medication like you have always done. So you can do it online, which is the best way of doing it because it's always the most up to date. If you need to phone us, you can phone us. But remember, we're inundated and we'd much rather take the calls for people that need appointments, not for prescriptions. You can do it through our website. Lots of ways to be able to do it. OK, so you order your meds. All right. When they're ready, we send you a text message. Now, for most of you, 80% of you, you will get a text message saying your medication is ready for collection. OK, please come and collect it. You've chosen Uphaven Surgery, etc. Netheravon Shop. And it used to be Durrington Surgery. Now we're saying you've got PharmaSelf. And if you get a text message from PharmaSelf, it means you're going to get a 6-digit code, OK, to be able to put into that machine and you will get your meds. If you pay, it doesn't matter to get your debit card, get your credit card, tap it on the screen, boom, OK, you get your meds. If you're exempt, you picked your exemption off that screen, OK, and out your meds come. It's brilliant. So really, really, really endorse it. OK, this is to make it easier for reception. The less reception in our dispensers have to do people at the counter for things like this, the more capacity they have to answer the phone, to mark you for arrived for your appointments. So actually using this facility at Durrington is brilliant. OK, it's 24/7. You can come at any point in time. You've got CCTV protection. It's all there. It's brilliant. So please, OK, have a look. Now, if you've got a question, answer that. But I'm aware of time and I can see people dropping off. But I did want to talk about the COVID vaccine because we are going to be offering boosters. OK, we haven't been given any dates for when that we are actually going to start, but we do know we're going to be offering all vaccine to everybody over the age of 50 and those who are clinically extremely vulnerable. So if you are aged over 50, you need a booster, we are going to be here for you. Okay, if you're clinically extremely vulnerable and you need a booster, here we are. Okay, now we have been told that we can give the flu vaccine at the same time as your COVID vaccine, but we've not been given the dates of our COVID vaccine yet. So we're going to set up our flu vaccination clinics, okay, for as soon as we get the vaccine, and we're going to start getting you to book appointments so that you can know that you can get your vaccine. Once we get our COVID vaccine in, we're going to adapt that as well, and it may need a little bit of reshuffling, but I don't think the likelihood is our COVID vaccine delivery will not coincide with our flu vaccine, and we don't want to delay vaccinating you for flu. So we're going to offer out the flu vaccine. You can book it to be able to do that, and then when the COVID vaccine comes out, we're going to look at that too. Now, your flu vaccines are going to be delivered from Upavon Surgery, from Durrington Surgery, and we'll do kind of what we'll call as mop-up clinics at Lark Hill, at the same place that we did our COVID vaccine from, because it's a massive building. We will be still vaccinating for COVID from Lark Hill, as far as I'm aware currently, because we haven't been given the OK to use different premises as yet by NHS England. So we can't bring it more local to you, but I am hoping that a lot of you had a good experience from Lark Hill. It's only one vaccine. We're still waiting for Pfizer as to whether or not you've got to wait 15 minutes, but we're hoping, fingers crossed, that may be disbanded because it'll be your third vaccine by that point, to be able to carry on and move forward. So fingers crossed that will work, but we'll keep you posted. But that is good news for all of you. Okay, you're going to be able to get vaccinated from us. We had a good way through last time, so let's hope. So we've got a question. Okay, so at the moment, somebody's just asked, will it be AZ, as in AstraZeneca, Pfizer, or indeed a different one? At the moment, we have not been told what we will be getting. So we don't know what the third vaccine is going to be, that booster for you all. However, if you come back to us, of course, what the government knows, what NHS England knows, is that what you've had first, so in terms of AstraZeneca or Pfizer. So I think there's going to be quite a lot of guidance coming out in the next 5 to 8 weeks, saying what vaccine we're going to need to vaccinate you with. Trials are ongoing about different types of vaccine being used for different combinations, so we'll have to wait and see. But we don't know the type of booster it's going to be at the moment, okay? But as I always did, and I can promise you, I kept you updated with what was going on in the last lot. I promise we'll do it again, okay? So, yeah, rock on this winter. So yeah, thanks for the feedback in terms of Lark Hill is brilliant, so well run and efficient. So yeah, it's a good system, and we'll look to keep that level of efficiency even greater in terms of whatever we're going to do going forward. So somebody says, I was in the medically at risk pool of people. Will this require a booster vaccine, please? Yes, so that's clinically extremely vulnerable. I'm really sorry, I use a different term, but those who were clinically extremely vulnerable from COVID, we're in cohort 6 of being vaccinated. Okay, so you are in our cohorts for boosters, to be able to work through. So hopefully that's good news for you all. Get the word out, book your flu vaccine with us, okay? Book your COVID vaccine with us when you can. And yeah, we should help our community to stay as safe and well as possible through this next winter that's coming. So moving that on, hopefully we can do that. Now, somebody's asked a question, and I'm going to flip back to Pharmaself. So somebody says we've lost sound, Stuart. Don't know if that's the case for everybody, but in terms of that, I'm not sure if everybody's got a problem with that. There's nothing coming up on my screen, and I'm not muted to be able to do that. So somebody's asked, can I switch from Lloyd's Pharmacy to the automated collection at Durrington? No, it's a tricky one. Okay, I declare my conflict of interest in terms of Sarum Pharmacy. I have gone out to Lloyd's and Durrington and said, if you want to use our machine, you can for delivery of meds so that you can come and collect them. Lloyd's never came back to me. I also went out to Sarum Pharmacy and other pharmacies that are in the local area that deliver to patients locally, and said, do they want to use our services? And indeed, Serum Pharmacy came back to be able to do that. So you can collect if you use Serum Pharmacy. At the moment, you can't collect from us if you use Lloyds in Durrington, but my offer to Durrington Lloyds still stands. If you want to use some of our space to help people collect their medicines, I'm quite happy to offer that. But at the moment, you're either a dispensing patient or you use Serum Pharmacy to be able to do that. But like I've said, that offer is out to pharmacies to be able to use it. We are capped at space. If we had an issue with space, we are going to have to reduce what we can offer to all third parties to be able to do that. But my main interest is for you to be able to get your medication. So hopefully that's useful. To be able to do that. So people are coming through saying they can hear me, which is wicked. So thank you. To be able to do that. So yeah, so that's all good. And we can go forward. Based back on COVID, what I just wanted to say again was the thanks to all of our volunteers who helped with our COVID vaccination programme the first time. I was hoping that our key rings that we had ordered an age ago for you all were here already to be able to show everybody the key ring that you're going to get, and unfortunately they haven't arrived as yet. Still, they've all been made especially to say thank you, and so you should be receiving that through the post or through a personal delivery. But we couldn't have done what we did with our COVID vaccine without our volunteers. So please, you've been awesome. Okay, right, next question. Somebody said, have you any information on opting out of the NHS to be able to use your medical information? That was what we talked about in June, wasn't it? About the opt-out. Now, one, that there was an extension to the 1st of September. Number two, our website provider is just about to go live with the opt-out form on our website, so you'll be able to opt out if you want to. Brilliant to be able to do that. You've got to look at it. It's all about planning and research. It's a personal decision, okay? You need to think about that. If you don't opt out, you are automatically opted in, and your data will be collated and retrieved from our system on the 1st of September. Now, last time when they put that rush position out, and that's really honest, isn't it? It was rushed, saying you had to get your opt out in by the 23rd of June in time for the 1st of July. Still use that concept. The sooner you get that into us, the better. When it's properly live online on our website, we will be sending the link out like we promised last time. That is not to encourage you to opt out. That's about giving you the choice of knowing what to do and how to do that. Okay, really important to be able to look at that. So somebody says, I've opted out, but if I download the NHS app, not the COVID one, I don't know what that, I'm a bit confused, Karen, about that. So I'm not too sure how to answer that question, not too sure on the question, but I will do if indeed you can still log in and we've finished if you don't get back to me. So hopefully that's been really useful to kind of touch base. We've covered a huge amount from our appointment system and trying to go back to pre-COVID and the brilliance of our systems. I know they don't always match for everybody, but remember, we did try to accommodate our systems so that everybody could find their own path to best use NHS services. So we've done that. You can see what you need, what you will be expected to have a phone call for and what you'll be expected to come in. Please answer that phone. I know it's really important. I know it can be really difficult. I know there's lots of things going on, but it does increase our capacity threefold if you answer it the first time. That means we can see more of you and it's more sustainable for our team to be able to do that. Remember, it's a private number to be able to look at it. If you can do it online, do it online. That's quicker. I don't want you waiting on the phone. It just irritates you. I totally get that. So yeah, it's just frustrating all the way around. And that's the difficulty, what we want to avoid. You've got PharmaSouth 24/7 collection. Awesome. Okay, and remember, our COVID boosters are coming. We've got flu coming, so rock on winter. But for now, remember, when you come in and see us, wear one of these. Okay, so keep us all safe. I know you don't have to elsewhere, but we need to look after each other. This is not over yet. So on that note, I'll say goodbye.